Welcome back. To complete our discussion talking about sports injuries, part 2, joining me again is Dr. Steve Huang. He's assistant professor at the University of Oklahoma School of Community Medicine in sports medicine. Let's jump in. Now, I want to talk in this segment about a few other sports, but I want to start with golf because so many young kids are interested in golf. Tell me a little bit about golf, and I know off camera you told me about your 4-year-old son who is into golf, and you even bought him a little set of clubs.
Sure.
So tell me about that, especially being so young. What kinds of injuries could they be prone to? What do you watch for? And you as a physician, Dad, what kinds of things do you make sure you put in place so there's not some of these injuries or things happening?
Sure. You know, golf is an interesting sport because you do one maneuver several times, and it's only in one direction. And again, we're talking about overuse of a certain part of the body. Things we can expect are injuries with the elbow, the shoulder, the back, and that can be different types of things. One is what's called golfer's elbow, and it's kind of opposite of tennis elbow. Tennis elbow is pain and overuse of muscles on one side of your forearm. Golfer's elbow will be on the other side of your forearm, so on the medial side. Now, yeah, I was talking about my son Daniel, and he's 4 years old, and we did give him some clubs recently, and he loves to hit the ball. The good thing is that he doesn't play every day, so he's not going to be at that much risk. For those who play more frequently, of course, they're going to be at higher risk for injury. So if I go out, you know, once a week or once a month with my son, he's probably not going to be at very much risk for injury.
Okay, and so that's one of the keys, especially for the very young kids, because sometimes they love repetition. They can do the same thing over and over and over and over. So you have to monitor how frequently they're actually playing this. So like you said, you limit that repetition.
Absolutely. And that's just like any other sport. Running, basketball, golf, dancing, you know, all these things are great and we love to do them, but you also have to watch how much we do this. If you do it every day for 3 hours, you're going to have overuse injuries. If you do it once or twice a week in moderation, you'll be less prone to injury.
Now with this, with golf, you mentioned in our other segment about stress fractures in terms of overuse. So with golfing as well, you can end up getting stress fractures, or you don't tend to see it as much in golf as you do in other sports?
Yeah, you wouldn't see it as much in golf. Probably one place you may run into it is in the back, believe it or not, from the twisting. So the repetitive twisting and extension of the back, you may have a stress fracture in your back, similar to that of like baseball. But you're not going to see it that much in the forearm or in the upper extremities.
Okay. Now you mentioned about shoulder injuries. Rotator cuff, does this involve the rotator cuff? And if so, what is the rotator cuff?
Sure. The rotator cuff is a set of muscles in your shoulder which decelerate the movement of your upper arm. And it's one of the most complex joints in the body because it has such a wide range of motion. You can have rotator cuff problems from golf, less likely than in other overhead types of sports such as baseball, volleyball, throwing types of things.
Okay. Now, is there a way that you help sort of limit the overuse, say, such as in volleyball or baseball, so that you don't get this damage to the rotator cuff? Is there a protective, I'm always into protection, is there some protective gear you can wear, or is there anything?
Not as what we would expect.
Okay.
You know, braces are not going to change much about the shoulder. The protection that we use, or the prevention, is pitch counts. So in baseball, when you are young and even in the professional ranks, they monitor your number of pitches that you throw. And you know, even if you're looking at major league ball players, they're on a pitch count, even when they're healthy, of no more than about 100, 110 pitches in a game. After that, you really see lots of injuries. In the young kids, we really have shorter pitch counts, so after 50, 70 pitches, you know, that's enough, and they tend to get removed from the game.
And that may be why, too, you're just clarifying for me why sometimes with younger kids you may see that they don't pitch every single game, especially if they may have 2 or 3 games in a given day. is for things such as that, is to try to prevent injury.
Definitely, definitely. And I think that we so much want to see our best players play, but especially when you're younger, we have to do what's right for our children and make sure that they're not abused in those situations. So there are pitch counts per game, there's pitch counts per week, and there's actually pitch counts per season and per year. And for throwers especially, it is important that they take a season off so that they're not throwing all year round nonstop.
Okay. Now, in terms of volleyball, is there, especially for youth, are the same types of limitations there? Because you talked about the rotator cuff injuries being the overhead kinds of things with volleyball. How do you limit volleyball?
That is a very good question. I don't know that I know the answer specifically for
Okay.
you the way I know baseball. I think it would be very hard to limit the number of times you're going to serve and the number of times you're going to spike a ball. Additionally, it probably does not require the same speed as, say, throwing a baseball.
True.
And when you are serving a volleyball, it simply is not the same amount of stress. But I don't know if they have counts for serves.
But there may be certain kinds of things, like say where you try to rest and not play so many games back to back to back, or certain things like that. I would hope so. I would hope so. They should be listening to us and make sure if it's not there to put it there. Let me ask, in our last minutes together here, a couple minutes, about runners. Tell me a little bit about some of the most common injuries for runners and how to prevent those.
Okay. Runners, of course, we're looking at the lower extremities again. So we're looking at the knees, the feet, the ankle, the hips. And again, injuries are going to come with more use.
Okay.
And so a higher mileage, the higher the risk for injury. Typically this happens at about 20 miles per week and then at about 40 miles per week. Okay. So if you're running 10, 15 miles per week, you're probably not at that much risk. Once you start to get higher and higher per day and per week, you will have higher risk for injuries.
Okay, now let me ask this in our last couple seconds here. Surfaces for runners, does that make a difference? The treadmill compared to running on grass, compared to running on concrete, do those things make a difference?
They do make a difference. Running on concrete would be the worst. Running on a treadmill is probably the easiest. Grass is going to be somewhere in between, but you also risk running on an uneven surface or injury from stepping into a ditch or a hole or an uneven area of grass.
Okay, so they should pay attention to your surfaces as well as what you're wearing for your shoes and the conditioning for that as well.
Absolutely.
Well, Jake, as always, is telling me I'm out of time. Doctor, thank you so much. We've covered quite a bit, although I left some out, but I know where to find you to have you back again.
Sure.
Thank you so much.
Appreciate it.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments or suggestions for future shows. Please write me at Health Alert, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. Thanks so much for watching, and I'll see you next time. And remember, pay attention to discern. Thank you so much. Well, discern ever. Oh, for help. Discern ever. Pam Butler. Discern ever. Up to your discern ever suggestions. Discern ever shows. Discern ever. Health. Discern ever. Discern. 50913, Oklahoma 74150. Or if you email trail, email me at USA@gmail.com. Thanks for watching, and I'll see you next time. Pay attention to. Thank you so much. Well, for Health, Pam Butler. I'd love to hear your